Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast. This is Dan Carter, back in the studio this morning. If you've ever been here to Countryside Equine Hospital, you will recognize the studio. It is Treatment Room 1, or Dan's Land, as everyone likes to call it. Got out of Caroline Brown, back with us this morning. It's been a minute.
It's good to be back.
You know, podcasting. It's a great way to start the day.
It is. It's Friday.
It's Friday.
You know, weekend's here. It's nice and cozy and rainy outside. We're like, let's just pod.
Yeah, let's just podcast today. I agree. The rain, I was not expecting that this morning.
No, it was weird. Even my husband was asking me, he's like, is it raining? I'm like, no, it wasn't raining when I was downstairs. And then as I'm walking up the stairs, it's like boom, 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 boom. I'm like, okay, well, then I guess I know it's raining. So
yeah, this time in Georgia, it's usually like an afternoon thunder shower. It never rains in the morning.
No,
it
never. It's
thunder
weird.
Showers.
It's a little unsettling, but we're not going to think about that. So
I mean, but it's Friday. It can do what it wants.
Exactly.
So, yeah. So speaking of Fridays, that's what you call a segue.
All right. I'm curious to see where this is going.
Speaking of Friday, we're going to step back into talking about mares.
There we go.
I've decided. I think you can segue anything if you use those words. I'm a professional podcast.
If you don't think about it.
Yeah.
Or think about it a lot. If you think about this and you're like, actually, this makes sense because of this, please share.
Yeah,
Please draw us a little map.
Exactly. I just figure if you say, speaking of, I feel like you can change topics and everyone just goes right with you.
It doesn't have to be a straight line. It can curve and have a little, Mario Kart jump in there somewhere.
It's our podcast, so we get to make up rules as we go.
Oh my God.
Should not have given me a microphone. So, all right. Well, let's dive into this. We did an episode a few weeks ago. We were talking about Moody mares. We jumped into a lot of talking about estrus cycles, GCTs, manipulating estrus cycles, hormonal imbalances, things like that. But one of the things we briefly touched on, we're going to take a deeper dive in today. The majority of the time, it has nothing to do with them being a mare.
Nope. And it can happen to geldings.
And it can make geldings grumpy. So I put Moody mares and grumpy geldings all in the same category.
Oh, yes. And there's a lot of reasons that this can happen.
Yes.
This is where our detective work comes in.
This is the best part. This is where it's like, all right, it starts with an interrogation, actually, or getting a history, however you want to call it.
Sometimes feels like an interrogation.
Sometimes we get a little intense and people are like, am I on trial here? I was like, no, there's no wrong answer. Just tell the truth, the whole truth.
Did you put kelp in their food today?
Is there kelp? So that was a fun one.
The kelp.
Yeah, I had no idea. That was crazy. But yeah, so we're talking about other causes that can make mares a little moody, geldings a little grumpy. Really, if I was going to say it, instead of moody mares, grumpy geldings, it's like other causes of poor performance. And this can be anything from these horses are spooking at jumps, spooking in the ring, not wanting to go,
getting stuck at the gate, before you run, they're just irritable, they can look like anything.
Just not enjoying their job.
No.
So we're going to dive into that. What do you want to start with?
I mean, I think the first thing we talk about is we get a history.
Yeah.
I mean, we when you come to me and you say, hey, my horse is spooking at jumps. They are, not wanting to, go into the arena. They're swishing their tail or bucking under saddle. They're not where they need to be. Our first thing is we step back and we say, okay, let's talk about, when is this happening? Is it when you're riding? Is it when you're only at a show? Is it when you're at home? You know, what's the situation we have going on here? And a lot of people bring me videos or photos of things, and I love that, because sometimes you can see, you know, like I mean, we're going to kind of jump around with tons of topics here. Like, one big thing that we were talking about just yesterday was the eyes. Some of these horses literally can't see. And like one time somebody was showing me a video of, you know, the horse was coming out of the alleyway and going into this really bright arena. And I'm like, it's pitch black in there. And now they're going into this super bright arena. And the second they hit the lights, they freak out. And I go and look in this horse's eye. He's got big old cataracts. I'm like, well, maybe he could see a little bit when he was in the alleyway because his pupils are all dilated. But the second he gets in this bright arena and his pupils constrict, he can't see around that cataract now. So he's going to freak out.
And let's, you know, we kind of touched on it right there, but I want to go back before we dive into the topics. I want to talk about a history. You know, we joke it's getting a history, and sometimes it is an interrogation. We're going to ask tons of questions. And what I always tell people is, like, this is not the time to hold back.
No.
And I've had so many people, like, they'll come in like, well, I don't want to tell you anything because I don't want to sway your opinion. I just want to see what you see. And it's like, if we want to play Stump the Veterinarian, we can play Stump the Veterinarian. Or we can go in and give me history, like good history.
And it's usually the most, I don't want to say obscure detail, but a lot of times it's this very, like, one thing that you're like, I wasn't going to say this, but, and it seems so minute. And then you're like, oh my God, that's it.
That I was about to say, it's that the best words are, well, I didn't want to say this, or I didn't know if this would be important. I didn't know if this would help, so I haven't really said it. Anytime I get those words, I know you're about to drop a black swan. You're about to drop, like, the key to this entire case. And it never fails. You're over there beating your head against the wall, trying to make sense of this thing. You've done exams. You're looking through, you're like, this isn't making sense. And then they drop that one detail that they didn't know if it would be important or not, and that's like the key to the castle. In negotiations, they call it the black swan. So, like,
oh, my spouse put, like, new spotlights out, and I'm like,
ding,
are they on timers?
Yeah.
Well, no.
Yeah.
Horse isn't sleeping. Exactly. And it's those one little details.
So when you're given a history, just word vomit. Throw it all out there. And you know what? If you can get it in chronological order, great. If you can't, we'll sort through that. I mean, I can't tell you how many times people come in. I sit down over here at my counter. I got my clipboard out, I got my papers on there, and I'm just over there. Like, there's a page and a half of notes. And they're just talking, and I'm just writing. And then I start asking questions. And I mean, this can be a 10 or 15-minute process, just diving into what the history is. So if I could tell people anything, when you go to the vet, just not the time to hold back.
No.
Lay it all out there.
Don't lie.
If you did something stupid, we're not going to judge.
No.
We don't care. Give us the details. So we just want to help the horse. And it never fails. It's that one obscure thing. Just that one obscure thing.
That one little thing that you didn't think was super important. It's like, nope, that's it. That's it.
And, and I think that gives us, the more history we have, it gives us, when we're doing that exam, it gives us things to pay attention to, because it's going to start in that process, starting our thought process, going down this road. So, you're talking about eyes. I want to talk about that a little bit.
Yeah.
I had a really interesting case. You actually looked at it with me yesterday. This horse was going to the jump and did not want to make the jump. And it was almost like scrambling, like she described it as pee-offing in front of the jump. And it was interesting because wintertime and Tryon, not an issue. All of a sudden, we get the hits in Ocala, and it's an issue. We go to Aiken, it wasn't an issue. We go to another place, it's an issue. If springtime gets here, it gets worse and worse. And she had told me all that stuff, and I didn't quite know what to make of it. Then we're jogging the horse, and then we're looking for a lameness cause. We're jogging this horse. And I realized, like, this horse is bumping into my tech. Like as it's jogging, this horse is bumping into my tech. She slows down and the horse keeps going. And this is a horse I've looked at before. It knows how to pick up what the jogger's doing. And all of a sudden it dawns on me like this horse can't see. It can't see. And the reason and then when the history made sense because we get to Florida, we're closer to the equator. Bright white sand, bright sunny days. We got a reflection, pupils constricting, and boom, we can't see. Now, I didn't get it right. I saw cystic corpora nigra, so that for those listeners, like look it up. It's really cool. It's like this little cyst that comes off the eye that can drop down and block vision. And so I was like, I can make a case. Maybe that's causing the issue. And so I was like, okay, we need to get this addressed. Let's get you down to Dennis Brooks in Florida. We're going to go down. We're going to get this taken care of. Dennis looks at the horse. And if for those who don't know who Dennis Brooks is, he's like the most rock star. He's like the Elvis of ophthalmology. I mean, this guy is.
What if we could get him on the pod?
We need to. We really need to I would love to have him on the podcast. Dennis, if you have me listening, we'd love to have you on the podcast.
You're invited to the pod.
So he looks at it, and this horse has vitreal floaters. And it's these little you can probably describe them better than I can.
It's not even fibrin. It's more just like they're just little bits of tissue just floating around in the eye. And it's almost like a snow globe effect.
Yeah.
So as they're moving, it's floating around and can constrict their vision.
And so when this pupil constricted down, we got a narrow window to see out of. The snow globe goes off and we can't see.
And there was a lot. They said in one of the eyes it was like very, very heavy. And so, yeah, not enough light getting through. Horse can't see. And so he panics.
Yeah. And you know what the treatment was? Time. The other one, sunglasses. He had little goggles on. And all of a sudden, his pupils could stay bigger. And we could see. And it was one of those that I remember getting that, and it was like one of the most satisfying things. You know, and I'm the lameness. Usually I'm trying to push everything to a lameness, but again, when I'm looking at poor performance, it's not just lameness. Like I'm watching every detail. And that's the thing. Veterinarians are watching those details. And it was that little detail of like, this horse keeps bumping into my tack. And like when he'd go to turn around, it was like he was kind of scrambling a little bit trying to see what was going on. I was like, daggone, we can't see. And that was the whole issue. We've seen him, we just saw him, and the vitreal floaters eventually settle out. And they just kind of settle down the bottom of the eye. They stay there, they quit floating around. And the sucker's back 100%. 100%.
But, you know, and I'm sure, you know, it's a sport horse. It's like there's going to be something that needs injection. There's going to be something there. But it's like, no, if a good veterinarian is going to look at the whole picture and see the whole thing and be like, no, this is the problem. And it was.
She had, again, it was beautiful. She came in, gave an amazing history, had video. We're looking at the horse, and it's like ding, ding, ding. Like, yeah, there was some stuff. Like, I remember that when we found I think it was a fetlock joint that was having an issue. But I was like, I can make that better, but that's not causing your problem.
Yeah, that's not the issue.
That's not the issue. We'll solve that problem, but we got to go solve this one first. Until we can see, I'm not worried about this fetlock.
Right.
The fetlock will make us perform better, but the eye is what's going to allow us to actually perform. So it was a really cool case. And again, it goes back to great history. We had some video of the problem, and then here we go.
And it's just, you know, looking at it from a different perspective, being like, okay, maybe we're going to take the lameness hat off today.
Yeah.
And we're going to look for something else.
Well, and that's when I tell people, like, it's sports medicine is not just lameness. It is what is affecting this horse that is allowing it not to perform. And I think that's one of the big misconceptions. A good sports medicine vet is not just a lameness person. They're looking at every aspect of this horse. They have to understand every aspect of it and why it's not performing.
Because, I mean, kind of segueing into that, I mean, you know, let's talk about pain. Their pain can come from a lot of places.
Mm-hmm.
Lameness, yeah, you can have, some sore joints or, a tendon injury. You can also have stomach pain.
Well, and chronic pain.
Mm-hmm.
Chronic pain, even if it's not like huge pain, like abscess type pain or an injury type pain, if they've got low, subtle, chronic pain, what I compare this to is if you've ever been around people with chronic back pain.
Oh, they're miserable.
They're grumpy.
Mm-hmm.
They have trouble sleeping because they hurt. They have trouble moving around because they hurt. Everything they do hurts. And they get really grumpy. And so even it may not be severe pain, but it's just always there.
Mm-hmm.
And they're gonna get grumpy.
Mm-hmm.
And so chronic pain, stomach. Let's talk about that.
Let's talk about stomach pain. So, that's a really common one we see, and that can present in a lot of different ways.
Yes.
A lot of ways. It's everything from, that just kind of poor performance, irritability, when you're going and doing things with them. We have some that they present more with colic signs when it comes to, stomach pain and then everything in between. And we should add this now. The degree of the ulcer does not correlate to how severe the pain symptoms are.
Does not. Clinical signs and severity of ulceration do not correlate at all.
I've seen some horses they look like they've had claws like dragged down their stomach, and these guys are just kind of, a little touchy, like maybe a little tail swishy, but they're not having performance problems. And then I have other ones that are about to buck somebody off, and they just have a little grade one hyperkeratosis, little angry, but not like something crazy. But all comes down to you fix the ulcers, you make them more comfortable, and they're a totally different horse.
Well, and it was actually number 2 cause of poor performance now is stomach ulcers.
Number 2. Wow. Okay.
Number 2. So number 1 was lameness.
Mm-hmm.
Number 2 is actually stomach ulcers.
Wow.
When they're looking at all the data.
That's awesome.
And it can truly affect performance. Anything from, they not performing as well as they used to, or it can be they're simply refusing to perform.
Mm-hmm.
And it's not just in a performance horse, but we see it in horses where people just want to, they're just using them for trail ride. And it's like, man, they're spooking at stuff on the trail they've never done before. They're not wanting to move out as forward. It doesn't just affect performance horses. It affects all breeds, all ages. It affects everything.
I've got a mounted patrol horse right now that's dealing with some nasty ulcers, and yeah. Mm-hmm. This guy's totally different now that we're treating him.
Well, and that's the thing is it's, again, you've heard about on this podcast a lot, like understanding, like knowing what you're treating, like an accurate diagnosis. This is critical. And it's a simple thing to do. It's a gastroscope. It's a really simple, really simple diagnostic procedure. Done in a sedated horse standing. We're passing a small camera down in their stomach. We're looking around, and you miss more not looking than not knowing. Mm-hmm. And a lot of people want to talk about. And if you listen to our ulcer podcast, people are like, "Well, can I just throw him on some Gastrogard and see what happens?" And it's like, no, because there's different types of ulcers. It's the squamous ulcers, the glandular ulcers, pylorics, knowing which one we have. I had one that they were at a horse show. The vet said, he's got ulcers. Let's just start treating him. Well, they did. And they just threw him on Gastrogard. He got a little better, but not 100%. Scoped that horse when he got home. He's got a raging pyloric ulcer down there. Oof. Like a week on misoprostol, and we're back. Mm-hmm. That's how quick it was. It went from having to scratch to a week later, bam, got it done.
Oh, yeah.
Because we knew what it was.
Mm-hmm. Well, and too, yes, we scope the initial scope, but we also recheck scope.
Yes.
Because some of these ulcers can take multiple months and cycles of trying to treat them. And if we don't completely clear the stomach before we stop our treatment, guess what? Those ulcers are going to come back, and they're going to continue to be a problem.
Let's get the problem solved.
Yes. I'm like, we can get it. And then we know what we're getting into. We know what we're managing, and we know, where to go from there. Because, people will say, oh yeah, well, I did the ulcer treatment. It didn't work. I'm like, okay, but did you do it to completion? Did what we started? Did we fix it? Did something else develop? We don't know. We have no idea.
Once you know the answer, you can do what you're supposed to do, how you're supposed to do it, and when you're supposed to do it. And 99% of the time, they're going to get better. Mm-hmm. So, yeah, stomach pain, huge.
Very big one. Very big one that we come with. That's probably, when we get these, kind of performance issue, Moody, May, or grumpy gelding cases that come in, like that's one of the first things I say is, well, has this horse ever been gastroscoped?
Absolutely.
Because again, it can look like anything.
Every one of them I do, I start with a performance evaluation and I start with a gastroscope. That's usually, and that's going to fix like 70-80% of them.
Yeah.
Like most of them are going to get fixed right there.
Or at least start checking some boxes.
Yes. Because that's the other thing. You get into these, the better history you have, the more you can have an idea where you're going. But sometimes we have to get in like, all right, we got to start checking some boxes. I had one having issues, poor performance. On a lameness exam, looked fine. The horse didn't want to move forward. It was balking. It was kicking out. Lameness exam, everything looked fine. Gastroscope, everything was good. So we're like, we got chronic pain coming from somewhere. Bone scan. Use some nuclear scintigraphy. Got that horse, and if you don't know what nuclear scintigraphy, we need to do a podcast on that. Nuclear scintigraphy is a cool tool. It's like a full body scan. This horse had a lot of increased uptake in the fetlock joints, and it actually had bone bruises or bone contusions on the bottom of the cannon bone of the fetlock joint. Well, because it was equal bilaterally, the horse didn't have an asymmetry at gait, so it looked sound. It looked sound, but you could tell like he's not comfortable. And that's the big thing. There's lame, sound, and comfortable. And we're talking about moodiness, grumpiness. That's the difference between sound and comfortable. And it's comfortable with body, just like we talked about with an ulcer.
Right.
But we were able to put that horse in a bone scan, do a nuclear scintigraphy on it, identify the issue. We're in the process of treating that now. And again, there's knowing what we had. It's like as soon as that hit, like the entire case made sense. We actually traced it all the way back to an event that happened 1.5 years ago.
Really?
Yes.
Wow.
It was pretty cool.
That's wild.
Traced it back, boom, there's our issue. Because we'd be okay on the flat, but when we jumped, we had issues. We never let it heal. Because, again, he didn't look lame in the classic sense, but he didn't look comfortable. And so nuclear scintigraphy got the answer. Life's pretty fantastic.
Because again, I mean, and pain can come from a lot of places too. I mean, like, one of the things we talk about, like that comes up a lot is, back pain in horses. And, we're not going to go too deep into back pain. A lot of back pain there's primary and then there's referred, but I mean, saddle fit's a big one too.
Huge.
I think we've had a couple podcasts on saddle fit now, and that's a big one too. Even like one of these, hey, sometimes they're off, sometimes they're not. And then it comes down to, well, what saddle are we using? What pads are we using? Who's in the saddle?
That's always the interesting one, because you go through those horses and you're watching them jog, you're watching them lunge. Everything looks good, and you put a saddle on and they still look fine. Well, then you find out, oh, that's my jump saddle. Where's the dressage saddle? And they're finding the dressage saddle, not the jump saddle. Okay, now we got a clue. And I've actually had those horses where we've lunged them, they're not getting better. Let's put a saddle on. As soon as we put the saddle on, you watch them go around. They're like, nope, can't go. And like, there's our problem.
There it is.
There's what we're chasing. Had one the other day that had a broken tree.
Oof.
And until you really looked at it, you couldn't tell. But I remember it was actually the lady's husband that found it. He's like, why is this thing a little crooked? And this is not a rider. And she's like, what? And he looks at it. She's like, sure enough, it's crooked. So they get the saddle fitter out. The tree was broken.
And it's just digging in there.
Yeah.
It's like when you have a tag that's just like digging into your side the whole time, and the horse is like, please help.
But if you didn't pick it up and sight down through it,
you wouldn't be able to tell.
You wouldn't tell. And
Gosh.
I was like, daggone. There was the key to the puzzle. The other one, muscle pain.
Yes.
This one, like when you said back pain, the first thing I thought about is muscle pain.
Yeah.
And muscle pain can have a huge, like you talked about, a compensatory issue. If we're sore behind and that's not being addressed, it causes our pelvis not to be in the position it needs to be, causes our back muscles. I compare it to a lot of people that walk with a limp. They'll they're sore in their knee, and then next thing they know, they get referred pain in their lower back. And so back pain can come from a lot of places, but it can also be primary muscle issues. We call it neuromuscular.
Oh, yeah.
And there's a bunch of those.
Oh, a ton. When the one that comes to mind is the one that, they were talking about here. They're like, oh yeah, well, we gotta lunge him for like 20 minutes before we do anything, because he's always like super, super uncomfortable. And then he gets better. And we're like, wait, you're doing what? And then turns out this horse has like a raging, PSSM. And I'm like, oh my God, everything makes sense.
Yes. And again, that one, there's things in the history that start to clue us in, and they're not, like I said, there's a whole host of them. They all present subtly differently, but then a lot of them, I always like to say, like, they're going to all of them look the same. Like 80% of it all looks the same. That last 20 kind of gives us an idea of where we need to go. And so when you're looking at the muscle pain, again, you can have a compensatory issue from an undiagnosed lameness. And again, they may not look lame, but they're not comfortable. And again, there's a big difference between sound and comfortable.
Right.
And that's where the performance issue comes in. Sound versus comfortable. Some of them have these primary muscle problems. We can do a muscle biopsy, find out what it is, get very targeted on our treatment, because the reason that muscle biopsy is so important is you could have MFM or you could have PSSM. The two treatments are completely different.
They are.
Completely different. The diet's completely different. And so if you're trying to just guess your way through this, you're leading to frustration. You're just going to be frustrated. Because once we know what it is, I tell people, you're 6 to 8 months sorting through this. And so if you're going to try a diet trial, you're committed for 6 to 8 months. But then also, if it's not that and you're treating it wrong, we may be over here tweaking to try to manage this condition when that's not the problem at all.
You might be making the actual problem worse, depending on what you got going on.
Yeah. So knowing what you got, I cannot, like, if I had to sum up what the Equine Vet Connect podcast thing says every single time, it's accurate diagnosis. Don't guess your way through life. Accurate diagnosis. Do it right. Back pain, and the other thing is saddle fit leads to back pain. So all these things can lead to back pain. Which one is it? History, thorough examination, accurate diagnoses. Boom. Problem solved.
That's crazy. And it's, again, too, this is not a simple, we come in, we figure it out first try. A lot of times we are having to go through and, do a bit of a scavenger hunt, check off boxes, start going through things, because, it may be one big problem. It might be a lot of small issues too, or it might be something that we find along the way that we're not necessarily looking for. And then you're like, oh my God, that's it.
Yeah, I tell people a lot of times, we'll get to the bottom of this, but don't expect it to all happen in one visit.
Right.
Because we're going to start cleaning things up. And as we start cleaning things up, and it's interesting because these horses will come in having issues performing. We'll find something, and we're like, and I'm honest with people. It's like, this may take multiple visits because we found a glaring problem today. Like, I just had the phone call last night. Had his course come in. We started doing some maintenance on it. The issue was hind limb issues. We did have a positive flexion up front, but there's only so much you can treat at one time. And I said, let's get the back end right, and then we'll come back to the front end. Well, sure enough, it's been 2 weeks. I get the call from the trainer yesterday. He's off on the front end again. He's off on the front end. We got to get this done. I was like, we expected that. But the front end wasn't the glaring problem because we had the back end. We had a hind end issue and a forelimb issue. We got half of it fixed. Well, now the other half looks like this glaring problem. And I've seen it even, like, you can have a horse that's got some joint pain, foot pain, and stomach pain. We get the stomach pain fixed, and now it's glaring that we have a soundness issue. And so it can take multiple trips, multiple visits. It's kind of like peeling an onion.
Right.
It's peeling an onion.
And sometimes the more you uncover, the more you find too. Right. You start looking, you're going to find things.
And you start, and what I tell people is like, we're going to find something and we're going to fix it. And we're going to fix the next thing and the next thing. And because we didn't get here overnight.
No.
And that's the thing with every one of these histories, this didn't happen overnight. You know, like we're in July now and have people say, well, this started back in January. We started noticing this. Then we kind of worked through it. We thought it was a training issue. And then we worked through this and we got better. Well, then we started backsliding again. We worked through that. So now we've had 6 months of this developing. So the thought that we're going to fix this in 30 days, nope.
No.
It didn't take us 30 days to get here.
No.
It's not going to take us 30 days to undo it. We got to peel back these layers because, like what you just said, it may not be a big problem, but if you got 4 little problems, now we got a big problem.
Now we got a big problem.
These are adding up to that clinical sign of moody, and grumpy.
I'm uncomfortable. Chronic pain.
Chronic pain. Chronic pain.
Yep. I mean, and again, it is a complete workup. It is we are going through everything. And a lot of times I am going to go back to like, okay, let's go back to our history. You know, what's in our diet? Where are we riding? Where are these problems showing up? Because a lot of times we do have to go back and kind of think about it. And this is where we powwow about stuff a lot too.
A lot.
Like we start powwowing and we're like, okay, this is what I've already done. This is what I've uncovered. This is what I've fixed. Like, where do I go next?
Well, it can be little things like we talk about even show venues. I mean, I've sat down and asked y'all, you and Caitlin both worked over in Aiken for a long time. And 2 big venues over there, Bruce's Field and Stableview. And literally I've had to ask y'all, what's the difference? And you're like, okay, this footing's like this one's like this. Okay, that's fitting because I'm having issues at Bruce's but not at Stableview, or vice versa. And so understanding, like knowing the kind of footing that's at Trine, what does WEC have? What does HITS have? What does Conyers have? What does Aiken have? Understanding how all those things blend in, because like if we're going to talk about another place of chronic foot pain or chronic pain is feet. You can have feet that are sore and not comfortable, but not lame.
Right.
And then all of a sudden we start finding, well, I have trouble at this venue, but not at this one. Well, okay, well, I know that this has got a synthetic footing. I know this one has a natural footing. I know this is more of a hard packed clay that's underneath with a little dusting on top. I know this is a deeper spot. And you kind of get an idea. And I talk to farriers that work these showgrounds, and I always find out what are the conditions like right now.
Which ones do you like and which ones do you not like?
Yeah. And that's, you know, and we're talking about sore feet. Again, one of the things that farriers will often say, like, well, it can't be a foot problem. I mean, he's sound, isn't he? Well, he may be sound, but is he comfortable? And there's a difference. Because I got shoes I can wear and I'm sound in them. But I'm not comfortable.
No. That's a good way to put it.
Yeah.
Yeah.
And that's what I think about. I mean, I've got some shoes that are really comfortable. I've got shoes that, I'm sound, but I'm not comfortable.
Or, you know, your shoes are fine if you're walking around on, you know, level ground, but you get on some rocky ground or some more uneven ground, and all of a sudden those shoes aren't doing you anything.
I thought about this the other day. I go walk in the mornings, and what I walk is dirt roads. And I found myself literally, I was in my tennis shoes and I was walking down through there. And all of a sudden I found myself jumping from one side of the road to the other. Because what I realized is that tennis shoe has a really, you know, doesn't have a lot of support in the shoe. So when I get on some of the bigger pieces of gravel, it was bothering me. I was still sound, it just wasn't comfortable.
Right.
And so all of a sudden I noticed I'm jumping from side to side. So the next morning I'm like, I'm going to put on my hiking boots. So I put my hiking boots on. Boom, gone.
Interesting.
Because it had the necessary protection that I could walk across those rocks and it didn't bother me.
Right.
So foot pain, it's real. I can even remember back in my shoeing days, I had horses, depending on where they were going. I was always, you know, because I always ask, like, hey, what are we looking at show-wise for the next 4 weeks? And be like, oh, we're going here and here. I'm like, I know we don't normally have pads. You're getting pads. Why? Because that place is notorious for getting a footsore horse.
Interesting. Yep.
You're going to be there for 2 weeks. We need to do this. So,
or like, yeah, my horse has always historically been barefoot and they're fine. I'm like, okay, but we recently moved to a new property and there's a lot of rocks on this property. And yeah, I know they weren't footsore before, and they might have been fine, but we've changed our environment.
Or they were great barefoot in July and August because it's hotter than could be down here and you weren't riding. Now all of a sudden we're riding because it's fall, it's beautiful, we're riding more, we're going different places. Now we're getting footsore.
Mm-hmm.
And we're not seeing lameness. We're just seeing like those little short choppy gaits up front.
Or they're a little reluctant to like walk outside on the gravel, and I'm like, there it is.
Yeah. But it's chronic. And like I said, they may not be limping, but they're not comfortable.
I saw one a couple weeks ago that like I'd been telling them for almost a year, please put shoes on this horse. Please put shoes on this horse. And they were very resistant. They didn't want to do it. We finally did it. And I look at this horse, and we'd, done all the other little lameness things. We had some hock soreness. We had, started a little equine, done some things. I've never seen this horse so relaxed in his life. He was a completely different man. Like, and the owner's still a little like, well, we're trying to do this. But I'm like, okay, but look at this horse. I'm like, this horse is comfortable. Like, this horse is so much more relaxed. He's so much more willing to go and do things for us. Like, we've changed this man's life.
I've watched. What's always interesting is we'll get these horses that come in and they're difficult to deal with, and we take them out and we start jogging them. We see a lameness, and they're just head up, looking around, on edge. They're tense. They don't want you really touching them, and you start doing nerve blocks, and all of a sudden you block out a pain issue. And let's say it swaps legs, you block out another one. And all of a sudden, as this pain is going away because we have these blocks in place, you're watching this horse's attitude just, like I watch him jog, and it's like a lame horse or a painful horse has a purpose about it.
Yes.
It's going down through there, and it's just tense.
And they're not looking around always. No. They're like straight ahead. They're like focusing.
And all of a sudden, you get them blocked, and they're just like,
do.
And it's like the first time they noticed there's a road over there. There's some cows next door. Like, this is going on. They never saw any of that.
Oh, yeah.
Because they were just locked in. I've got to just get through this. And they weren't necessarily looking cripple lame, but it's like it may be that we could barely see them off on the left front on the lunge line. Couldn't really see anything in the straight, but you see them. They're just focused. And then you come in, you block the left front. They go off on the right, you block it, and then you just watch their whole body just relax. It's more than just a pain thing. It affects everything.
Yes, truly. What? I mean, yeah. Wow, we've covered a lot in this.
I know, it's chronic pain. We can. I mean, and another one I think too. We forget about these horses stay in pain long enough. They can actually get neuropathies.
Oh, yeah, for sure.
They can get neuropathies. And I've had a lot of and what a neuropathy is basically this nerve has been stimulated. It continues to it starts firing, and it's firing so much that it just accepts this is normal. This is what I'm supposed to do. So even once the source of pain's gone, the nerve continues to fire. We see this a lot with laminitic horses. Like if they had chronic laminitis for a long period of time, they get painful. And it's more of a neuropathy or a neuritis, a neuropathic pain than a true pain. And we got medications for that. Like I use a lot of pregabalin on those horses. And it's like, we're just going to go through and reset those nerve centers. I've even seen something as simple as doing a nerve block. Stops that nerve from being able to conduct. And it gets this break, what we call wind-up pain. It gets that break, and then they get back. Then they start to improve because we told the nerve, like, that's not normal. Stop firing all the time. And it's well, that's where the neurectomy comes in, like to play when you get into those like really, really foot sore horses. I mean, that's the big thing behind that because again, it's like, yeah, you might have gone and fixed all of that, but they're still painful. And I've been real happy. I've been using more pregabalin in these horses. I'm not a gabapentin fan, mainly because it just doesn't work.
It's old. It's an old drug.
Yeah, it just doesn't work. But I've had some of these horses that we get them, we've done all our homework. We get them through. We treat all the things, and something's still not right. And I can put those horses on pregabalin for a couple weeks, and all of a sudden reset all their pain centers. And they're just like, okay, let's go back to normal life. Neuropathic pain.
Wow.
So And then there's other neurologic causes. I mean,
Oh, yeah.
we're not going down the EPM route. We'll just say
that's a whole nother podcast.
But yeah, if I had to, if all of a sudden you've had behavior changes, don't just write it off to my mare's hormonal.
Mm-hmm.
My gelding's getting grumpy. Some of it can be behavioral. I think we forget about it. It can still be a training issue or a behavior issue.
Or a brain issue.
We're not going down that road.
Those are a little harder to fix. I'm like,
They're just harder to figure out. I mean,
I was like, well, they might just be mean.
Yeah. But before you just accept that, make sure you've checked the boxes. Because I've had some people like, well, I thought it was a training issue, so we've just been trying to train them out of it. It's getting worse and worse and worse.
Mm-hmm.
And so, and it's interesting because I've seen a big change in the last probably 5 to 8 years. Used to everybody's trying to train everything out of them. And now that word's getting out that chronic pain can cause some of this behavior stuff, I have a lot of horses that come in. I was like, hey, you look him over. See if there's any medical reason he's doing this. Before I just lay into him, before I start pushing him, before I go to real hard correcting this, make sure there's not a pain issue somewhere that we're missing. Sometimes there is, sometimes it's not. It's just pure behavioral. Mm-hmm. But having those workups done to where you can say no, he's pain free. It's a
them problem.
And then we go fix the them problem.
Yeah.
But again, remember, some of these chronic pain issues may not be a them problem. It may be it's a me problem. That's because I'm tired of hurting.
Mm-hmm.
I'm tired of hurting.
Yeah.
So, pretty fascinating.
Yes. Very, very deep dive.
Yes. And this is also, we talk about it around here. Somebody comes in and says something's not right with my horse. We look. Yeah. And we look.
And we believe you too, because I mean, again, sometimes we're watching them go and we're like, well, they look pretty sound. But if you're sitting there telling me something's wrong, I'm like, okay, we're going to get to the bottom of this. We're going to figure this out.
We got to keep digging. And the answer is not, here's some Regimate.
No. I try to avoid it.
I do too.
I try to.
If you want to know the story scoop behind it, listen to the first podcast on Moody Mares. This one kind of delved into Moody Mares and grumpy geldings. It was like everything that could be causing issues.
Yes. Everybody tries to blame the reproductive system, and sometimes it is.
I'd say the majority of the time it's not.
Mm-hmm. Again, I'm going to bring up my stat from the first one that, UC Davis looked at all of the, hormonal panels that have been sent in on these Moody mares, and 84% of them did not have any sort of hormonal changes at all.
Kind of fits what we see around here. We send a lot of these out, and we don't really see that many.
No. So I'm like, yeah, these poor performance behavior problems. It's like, we're all the whole reproductive thing. That's only a small portion of it.
When AAP's done the surveys and they've looked at causes of poor performance, reproductive didn't even make the top 5.
Really?
Did not make the top 5.
Mm-hmm. Interesting.
So
interesting.
I don't think that's it.
No, but it's an easy scapegoat.
It is.
Well, I'm not even going to get into why, because I could ramble on about that for a while. That's a whole other podcast, but we're not going to get into that today.
No, but it's just know that if your mare's acting up, it's not a bad idea to check the repro tract. But again, that's just one of the boxes that we have to start looking at checking.
Yep.
Good histories, good physical exams.
Mm-hmm.
And there's certain key words that you got to hit before we start thinking oh, maybe this is a reproductive issue.
Yes.
And we've got the one we were talking about that was on the chronic Regimate, and the behavior was just really, really terrible. I saw that horse 2 weeks ago. Not on Regimate. Mare is doing fantastic. Mm-hmm. And what they're down to is they know when that time hits. They know when she's building a follicle, she's getting close to ovulation. They keep a calendar, and then they figured out the behaviors oh, this is where she's at. So we got 3 days. We're just going to back off. Mm-hmm. We're not going to push her. We're going to have a little Banamine on board before we ride. And you know what? Those 3 to 5 days, we're just going to back off on what we do, because she made a great statement. She goes, I'd rather deal with 3 bad days a month than 30 bad days a month. And that's really what.
I like that.
Yeah.
I like that a lot. Yeah.
She's like, I can manage through those 3. Mm-hmm. To have another 27 that are great.
Yeah.
So.
That's awesome.
I think it's, it's important.
All right.
Well, Dr. Brown, sum it up for us. What do you want our listeners to know?
I think it's and this is really scratching the surface of just all the things that could go wrong. But, if you're dealing with your horse and you're like, well, we're a little grouchy, we're a little moody, don't just write it off. Talk to your vet, and again, be open, be honest. We're not going to judge you. Now is not the time to lie to your vet, but be ready for a little bit of a scavenger hunt, because if you've got a good vet and they're willing to work with you, we're going to solve the problem. We're going to look, and we might find a lot. Mm-hmm. We might find a lot of things that maybe aren't relevant, but it's going to be that one thing that we didn't think was maybe super important that ends up being the key to everything. So, mm-hmm. Keep an open mind, and just keep looking, keep diving. There's something, because chronic pain can look like a lot of different things. And, we got to try. We got to start checking off boxes.
Yeah, I think that was a great statement you made. We may find things, but that may not be it.
It may not be it.
Because, a lot of times we're going to uncover stuff, but what we're searching for, I call it the migraine problem. Mm-hmm. You got problems, you got the migraine problem. I've never had a migraine. I know when my wife gets them. Nothing else really matters. Mm-hmm. The only thing that matters in her world is getting rid of that migraine. And so I said, we got to hunt for that migraine problem. What's that migraine problem? We may have had these other ones, but what's the migraine problem? And that could be a summation of a lot of little things. So, again, 3 people you don't want to lie to: your accountant, your lawyer, and your veterinarian. Tell us everything. Mm-hmm. Lay it all out there on the table. Help us get to the bottom of it. And remember, we didn't get here overnight, so we're not going to fix it overnight.
No.
It's going to be a process, but it's a very worthwhile process.
Yes.
So, fantastic podcast.
Yes.
Enjoyed this one.
Mm-hmm.
This is the world I live in.
Sports med world.
I know. Who knew we were going to take repro and go on a sports med route?
You always find a way to circle back.
I do.
So.
I did turn a colic into a muscle biopsy.
Many times.
Yes. I turned many a colic into a lameness exam. And been right most of the time. But again,
listen, I've had colics that are happening because the horse is super painful, from a foot abscess. It's happened to me twice.
Exactly.
That they're like, oh my God, they're throwing themselves on the ground. They're kicking in their belly. They're doing all this. And I'm like, why are they 3-legged though?
It's been going for a few days.
Bust that abscess open. The horse goes, oh. I'm like, well,
yeah,
there's your problem.
So get a good history. Tell us the history. Don't join in on the interrogation. Mm-hmm. No, there's no court of law here. Nothing's going to be held against you. Just lay it all out there. Be prepared. Write stuff down before you come in.
Yes.
When you're getting ready to come in for poor performances, you take. I don't know how many people I say. Take 30, 45 minutes, or it's going to be 4 or 5 days before you get here anyway. Make notes. Take
a video.
Yes.
Bring us some stuff. Bring us some evidence.
Yes. Get us going down the right track.
Put my Nancy Drew hat on. We're gonna.
Oh Lord! Now we're going back in the day.
Oh yeah.
Little Nancy Drew and the Hardy Boys. Mm-hmm. That was one of the first crossover episodes.
Was it really?
Yeah. Right now it's like Chicago Fire and Chicago PD. It's crossover, or ER and whoever and. Nancy Drew and the Hardy Boys, they did a couple books where they're out there solving mysteries together. Mm-hmm.
Teamwork, making the dream work.
I think they were dating. I'm convinced.
Well, yeah, that is actually some deep lore.
Yeah.
I can go into a lot of Nancy Drew lore, so I read a lot of those books, so.
I did read a lot of Hardy Boys books.
Yeah. I mean, yeah, Nancy's got her boyfriend, but she's going out with Joe Hardy for sure. So
100%. 100%. So, yep. Yep, and we just all showed our age. And, for
I don't
any
know.
of
Do the
you-
kids even read that anymore?
I don't know, but if you're a kid out there listening, you should read those books.
They're good. They're great.
Really good. They're really good.
Mm-hmm.
I would highly recommend. So parents, make your kids read the Hardy Boys and Nancy Drew.
Mm-hmm.
Teach them how to do it. That's where we learned our. That's kind of where we learned our history gathering skills.
Mm-hmm.
Like we learned
Started with Nancy Drew.
Didn't even know it.
Move up to the Agatha Christie's.
Yep. So all right. Great podcast. We appreciate all our listeners out there. Thank y'all for listening. Thank you for all the people that are helping support this podcast by listening to it. Like I said, we don't do it for sponsorships. Still don't even have one. I'm not sure I really want one. I want to be our podcast.
Yeah, I don't want to look like WWE over here with their Slim Jims and
Although if Duncan wants to shoot some coffee, that would be. No, Duncan, if you're listening, how about
we'll take some. We'll put a sticker up.
Yeah, we'll let this podcast run on Duncan. April, thanks for recording all this. Casey, thanks for editing it to make us sound like we know what we're talking about. And to our listeners out there, we appreciate it. From all of us here at Countryside Equine Hospital, you have a great week. Take care.
Bye.